Welcome friends. Today in this video I am going to talk about global period in medical coding. How to use global period in medical coding. So content of this video is global period, pre-operative and post-operative services, bundling CPTs, modifiers used based on global period, and global periods are 0 days global period, 10 days, 90 days, triple M, triple X, triple Y, triple Z. So let's get started without wasting a single time. Definition of global surgery or global surgical package. So global period is time frame following surgery during which routine care by physician, that is all necessary services normally furnished by the physician before pre-operative, during intraoperative and after means post-operative. The procedures are included in reimbursement of original surgery and they cannot be separately reported. Then list of global period status indicator. So this is one of the indicator 000. So endoscopy or minor procedure with pre-operative and post-operative relative value on the day of procedure only are reimbursable. For example, CPT 45378. These are the CPTs where if you go and check the global period for these CPTs, you will find a 000 means 0 days global period. Normally endoscopy and some minor procedures having 0 days global period. So here I just want to show you how to check global period in software. So I am using Codify. So if you check the CPT 45378 and just check. So this is the CPT, and if you click on fee schedule, so you will get a global period. Just scroll down and just check it here, global period. So global period is 000 means 0 days global period for this CPT. And what is the description of CPT is colonoscopy flexible. Most of colonoscopy, endoscopy, these are it's a 0 day global period. So next global period indicator is 010 means 10 days global period. So description for this is minor procedure with pre-operative relative value on the day of procedure and post-operative relative value during a 0 day post-operative period are reimbursable service. Evaluation and management service on the day of procedure and during the 10 days post-operative period are not reimbursable. For example, CPT 10060, 11401 and 46221. These are just an example. There are so many minor procedures having 10 days global period. So here I just want to show you post-operative period. Means post-operative period is nothing but global period. You can consider if it is sometime they mention post-operative period and sometime they will mention global period of 10 days. So both are same. So important note is if unrelated ANM service perform during the post-operative period, add modifier 24 with ENM and global modifiers 58, 78, 79 with procedure. So if it is applicable 58, 78 and 79, we can append this modifier with procedure code, and same day with minor procedure 25 modifier we can append with ENM. If suppose uh, patient came for the evaluation and management on same day 10060 this CPT perform, then we need to add 25 modifier with ENM service. And I just want to show you how to check modifier and what is the role. These are just a list of modifier 22 to 99. This is the provider service ambulatory service center modifier, and these are just category 2 and anesthesia modifier. So we just go to our provider service modifier. So here you can find list of modifiers. So I am talking about here global modifiers only. So here modifier 24 and description for 24 is unrelated evaluation and management service by the same physician or qualified healthcare professional during post-operative period. So post-operative period we need to check. If patient is in post-operative period and the physician is providing unrelated ANM service, then we need to add 24 modifier with ENM code. And likewise I said modifier 58, 78 and 79. So here also you can find first of all I'll show you 78 and 79. So here unplanned return operating room by same physician or qualified healthcare professional following initial procedure for related procedure during the post-operative period, and this is the unrelated during post-operative period. And modifier 50 modifier 58 also a global period modifier. So stage and related procedure service by the same physician or qualified healthcare professional during post-operative period. So that I have mentioned in here also. So these are the global modifiers 58, 78, 79, and these three modifiers always goes with CPT procedure code only, and modifier 24 always goes with ENM code only. So this is all about minor procedure and 10 days global period. I already said how to check global period also. So next an important indicator is 90 days global period. So major procedure with 1 day pre-operative period and 90 days post-operative period are considered to be the component of global package of major procedure. So here you can see evaluation and management service on a day prior to the procedure and the day of procedure and during the 90 days post-operative period are not reimbursable. See here you can see one the day of prior to the procedure, that is 1 day, and the day of procedure and during the 90 days of post-operative period are considered not for reimbursement. For example, here you can see CPT 3210039 00041 These are the 90 days global period CPTs. This is just an example, but there are so many CPTs you can find for under 90 days global period. So I just want to show you here. See 92100 thoracotomy with exploration. If you check global period, you will get here 90 days global period. So here if suppose thoracotomy perform on 1st of Jan, so next 90 days patient will be in global period for this CPT. If suppose patient is coming again back to the same physician and during post operative period for same reason related to the thoracotomy, and it's considered as a global package of major procedure. So it's not this service will not be separately reimbursable. But if suppose patient is coming during post-operative period for unrelated service, that time we need to add modify 24 with ENM service. So likewise we are adding 24 modifier for unrelated ENM service during post-operative period. So same we need to check global modifiers like 58, 78, 79 with procedure. If suppose any procedure performed during global period but it's not related to original procedure, so that time we need to apply and check the description of these modifiers, and we need to add according to the correct modifier with procedure. So it's very important 24 modifier we need to add with ENM service only, and these modifiers 58, 78 and 79 always goes with procedure CPT code, not with ENM code. So I hope you understand 90 days global period and how to apply it. So guys, here I am giving two example. One is if a patient is encountered to office for his neck pain, and in addition if the patient need his or her leg abscess to be drained, and if the physician does both on the same day, then the claim would be billed as. So what will be the answer? So first we need to check what is the service. So patient is encountered for office visit, so office ENM service should be billed, and then we need to check perform abscess drainage. So what will be the coding for this scenario? So answer will be, see here, CPT 99213 we need to bill because it's office visit. So here a description also you can find ENM with modified 25. Why it is 25? Because on same day 10060 incision and drainage perform on same day. So if you check 10060, this is a 10 days global period procedure. So it's a 10 days, it's a minor procedure, that's why we need to add modified 25 with ENM code. and then ICD will be M54.2, this is for neck pain, and one more ICD needs to bill is the leg abscess. So this is just a coding for this scenario. There is no global period issue in this scenario. That's why we are not adding 24 or any modifier with this. So we are just adding 25 modifier. Why? It is minor procedure, 10 days global period. So we need to add modifier 25 with ENM code. So next example, if the patient is encountered to office for his neck pain, and in addition if the patient need leg abscess to be drained, and if the physician does both on the same day, and patient is in global period of 90 days, last month patient had appendectomy by same physician, then claim would be billed as, so answer will be 99213 with modified 25. Why? Because on same day 10060 perform, so we are adding 25 modifier with ENM service. Then ICD, so here you can see modified 24 I have added. So why we are adding modified 24? Because if you read properly here, patient is in global period of 90 days, last month patient had appendectomy by same physician, means patient is in global period of 90 days, and what procedure they have performed? Last month they had appendectomy by same physician. So patient is in global period, but patient visited today for unrelated ENM service. So that reason we are adding 24 modifier with ENM service, and we need to add 10060 incision and drainage of abscess, simple or single. Why? Because on same day they have performed. Here you can see leg abscess to be drained. So that we are adding 10060 with ENM code with modified 24 as well as 25, and ICD will be neck pain and leg abscess. I hope you understand how to apply modifiers, so that you can able to code well and appropriately. So next indicator is triple M. So you can find triple M indicator for maternity code. The usual global period concept does not apply for this indicator. So for example, CPTs you can find 59610, 59610 is related to the maternity procedure. So this is generally does not apply any global period here. Then next will be triple X. Triple X is a global concept, does not apply for this CPT. For this indicator also we are not considering global concept. So for example, evaluation and management service for anesthesia codes, laboratory codes, radiology procedure. So example 7 series, 0 series, 8 series. If you check for this CPTs, you will get indicator like triple X. So this is the global concept does not apply for this code. The next indicator is triple Y. These are the unlisted code and subject to individual pricing. So if you check global status for this CPTs, you will get triple Y. This is just an unlisted codes. So this is also not impacting for global issue and global reimbursement issue. Then last is triple Z. These represent add-on code. They are related to the another service and are always included in global period of the primary service. So if you check suppose 17003, this is the add-on code, and if you go and check the indicator for this CPT, you will get triple Z is as an indicator, but it's always goes with primary code. So based on primary CPT global period, this CPT also going with along with primary code. So separately it's not having any global issue with any CPT. So if you get add-on code, we need to think about primary code only. So this is only the last indicator. I hope you guys understood global concept clearly. Thank you so much for watching this video, and if you like my video, then please like, share and subscribe Medical TubeMate. Thank you.